Let's go into the art and science of answering the phone. And remember, you got to remember this formula right here. Need questions equals money questions by service questions, primarily time. When we talk about service questions, it's primarily time, times trust. Trust are essentially clinical questions. And then there's curiosity questions. So need questions. Typically, we're not going to have too many need questions, again, because they've already been established or they would not have called. Money questions, their concern is how much money is going to cost them. Remember, that's the single most important question, and the variables of how to answer that. You'll lose more patients over that, not answering that question properly right there. Then there's service questions. Time is the most important one. We'll go into that. And then the trust questions are typically clinical questions. So this kind of puts it in perspective here. So money questions are very important. Time is very important. And we talked about 80% of the emphasis is on the money questions. So we've got to be really good and well trained and handle the paraphrases and the various forms of money. And then time, we talked about that, how to handle time. And then clinical questions are about 20%. So they're not as important. They are important, but they're not as important. And then service questions are only 10%, curiosity is 3%. So the reason I did this is to kind of put this in perspective. Because one thing you don't want to do, and this happens a lot, is think that a service question is as important as a money question. Or think that a money question is not as important as a curiosity question. See? So there are relative. There are relative values. So we need to understand that when people are talking about money, we got to pay a lot of attention, and we got to be really good. When we're talking about time questions, and a lot of that has to do with booking patients, that's real important because time kills all deals. And then the third one is the clinical questions. It's somewhat important, and then service questions are as important versus curiosities. Okay, and then we go into these key points. Never expect a phone call without any questions, and the patient just wants to schedule. It's rare to never. About 80% of the phone calls will average about 2 questions, usually in 2 different categories, like a money question or a service question. So you just got to be ready for it. It's got to be trained in. Okay, so having said that, now the good news is the patients will ask the same questions in different ways because they paraphrase it, they talk differently, but a lot of times it's the same question. But we typically only have to know 4 to 7 answers, essentially, per category because they're mostly the same. So let's go into some of these questions right here. These are the clinical questions. Now, before I go into these, it's good to have some of these on flashcards. And that has to do with training. In other words, we'd use a flashcard. One side would have the question, and we'd want the staff member to answer it. And then we'd flip it over, and there would be the answer. So that's the best way to train for a lot of these questions is using flashcards. Just just use a sheet of paper if you want. Cut a sheet of paper in half and write one question on it, in the back of it, the answer, and there you have it. But let me just get right to the point here with these clinical questions, which is this right here. Let me come on down here. Here's the most common answer. So there is a generic answer for clinical questions, and you want to be highly aware of this generic answer, okay? So the most common generic answer to clinical questions. Each patient is different. So whatever they ask clinically, each patient is different. Whether it's, are we going to get treated? Are you going to take x-rays? Okay? So we're talking about a clinical question. So here's the good, solid, generic answer. Each patient is different. The doctor will perform a consultation and exam that will tell them one of 3 decisions. Number 1, is it a problem chiropractic can help? Number 2, does he need to order additional testing? Number 3, can we start treatment immediately? Did that answer your question? Remember I said the question, did that answer your question, is very important to use to make sure that the staff member actually answered the question instead of just talked. Because you'd be surprised how many times people just talk and don't answer questions. Okay? So just be aware that that is a good phrase to have staff remember after they answer questions. Did that answer your question? And then when they do, we go to book them. Well, we can schedule you for today. We move them. In other words, we're going to move them forward. And of course, moving them forward means we're going to book them. And we're going to take them through the flow chart of booking. But have your staff memorize this, because this is a very solid, logical, reasonable answer to a lot of the clinical questions. And again, some of the ones I'm talking about, is he going to treat me today? Will he treat me on the first visit? Will he do x-rays? Will he accept x-rays from other offices? This is just, anytime there's a clinical question, this is a very good generic response. So, Mary, each patient is different. The doctor will perform a consultation exam, and that will tell the doctor one of three decisions. Number one, can chiropractic help? Number two, does the doctor need to order additional testing? And number three, can the doctor start treatment immediately? Did that answer your question, Mary? See, that's a great generic answer to the clinical questions. Now, let's go up to some of these common clinical questions that are asked. And some of them you do want to know the answer. I mean, obviously you want to know, but you can always have people ask way more questions than you can ever be trained for. That's why you just have to know the basic concept. That's why I just shared that with you. That was the basic answer to all clinical questions, period. Because we can't train 1,000,001 different questions. But there are some questions that are relatively common that we do want to give a direct answer to. So let's walk through. I've listed a lot of the common questions here, and actually a lot of these aren't even common. So let's go through the ones that are. We'll go through them all, but let's go through the ones that are common. Do I need a medical doctor's referral? Okay, that is a common question you will get with major medical people. Now, with their specific health plan. So that does need to be answered. Okay, so we can't answer that with the generic answer. We can, but that's not the best answer. So the best answer to this is, do I need a medical? So we definitely want to know. So obviously, what we're trying to do is to get to the no category. And so the answer is no, you do not need a doctor's referral to see the chiropractor. That's because and I'm just saying I'm kind of ad-libbing some other stuff, but I'll just get straight to the answer. So the answer to this is no, you do not need a doctor's referral to see the chiropractor. So we can schedule you for today or tomorrow, what works best for you. So that's the answer. Okay. All right. Our chiropractors, doctors, you typically are not going to get that. That is not a question you're going to get on the phone. That's a high confrontation question. That's kind of social media stuff, or out if you're doing a fair, that you're typically not going to get that question on the phone. Okay, but obviously the answer is yes. What does the chiropractor do? Now that's not typically that question is not typically what you're going to get on the phone directly. Now you'll get that again outside in social media or out in public at large. But one of the questions, though, asked that's relative to this is, how can chiropractic help my problems? See, that's what they're concerned about, their problem. They don't care about chiropractic. So what does the chiropractor do? But by the way, you do have to have the standard answer for that, and a very simple standard answer for that. And you want to also make sure it corresponds with your state law. What is your definition of chiropractor in your state law? And then you'll want to dumb it down. But what does a chiropractor do? The simple answer that I would always have are we always treat neuromusculoskeletal conditions with chiropractic adjustments to help relieve the nerve pain and muscle spasms. So it's real simple. I'm just going to use words like muscle, bone, nerve. We have spine. See, those, we're just going to really dumb it down. So make sure that your staff members do know a real simple, dumbed down version of that question. What does a chiropractor do? Don't get all crazy. What is unbelievable. So it's a natural method of healthcare treating neuromusculoskeletal conditions to help relieve pain and restore mobility. That's how straightforward, how simple that answer is. Next one, will the doctor adjust the treatment on the first visit? You will get this. This is somewhat of a common question you'll get, and it's typically from patients who've been chiropractors before. Now, obviously, what they're wanting when they ask this question is they want to get treated on the first visit. Okay, so one thing you don't want to do is we never want to tell a patient, no, we're not going to treat you on the first visit. That's something you would never do because it's 180 degrees contrary to what they want. Now, that doesn't mean, now be aware also that the word treat, they'll use the word treat, sometimes they'll use the word adjust, but remember, typically we will do something for the patient on the first visit, whether it's instructions, whether it's physiological therapeutics, doesn't necessarily mean adjust them, okay? So will the doctor adjust on the first visit? Now, the answer to that is the good generic answer. So if I said, well, the doctor do a consultation and exam and determine one of three factors. Do you have a problem chiropractic can help? Number one. Number two, does he need to order any additional tests? Number three, can we start treatment immediately? That's what the consultation and exam will determine. See, that generic answer fits right in with that. But the follow-up to that is, yes, he will treat you on the first visit if possible. In other words, we want to give a leaning toward, okay? But it will say if possible. Yes, the doctor will treat you on the first visit if possible, because that's what they're wanting. So we're going to say yes. But one thing we don't want to say is no. So this is where, again, it could be a big screw-up on the phone and lose the patient just by saying, oh, no, he'll just do the consultation exam on the first day, because they're not business-minded or they're thinking about the big picture. They're just thinking about your procedures. Okay. Do you take x-rays? That's a very common question. Will the doctor take x-rays? Now, what's the perspective the patient's coming from? Generally, they don't want x-rays. So, again, I can use the same generic answer. Well, the doctor do a consultation exam to determine three factors. Number one is, can a chiropractic help you? Number two is, what additional tests does the doctor need to order? Or number three is, can we start treatment immediately? So you see, that answer fits right there also. It's a good answer. But we still want to, if we can answer the question directly, we want to do it. And we want to pay attention to the slant. So what is the real slant on this? So it's the same thing. Will the doctor treat me on the first visit? Well, the doctor will determine that after a consultation examination. But if he can treat you on the first visit, he will. See, that's it. In other words, we're going to go toward the yes mode because that's where they're wanting to go. That's how this is answered. So we've got to pay attention to this. Okay, do you take x-rays? Does the doctor take x-rays? And that's another x-ray fear question. And the generic answer is the same. In other words, well, the doctor will do a consultation and exam, and that'll determine, number one, if chiropractic can help. Number two, if he needs to order more tests. And number three is if he can start treatment immediately. So it really depends on the consultation and the x-rays, what the doctor finds. But what do we want to slant? We already know the patient generally doesn't want x-rays, so what am I going to add to that on the end? We will not take x-rays if they are not necessary. See, I'm going to answer to the slant that they want. Can I bring x-rays taken at another facility? That's a very common question you get. And we're not going to go into how old are they and where did you have them taken or were they supine or prone. That is not the place to be talking about this on the phone call, on the first phone call with the patient. The answer is yes. Yeah. Do you take x-rays? Can you use x-rays from another facility? Sure. Bring them in with you if you can. Now, if one of the things you want to be careful of is we don't want to necessarily leave it up to them. So yeah, bring them in. When you get them, then come on in. You don't want to do that because life gets in the way. They'll never get the x-rays and they'll never come in. So what we'll do is said, yeah, and we can order those when you get here. So you want the office to take responsibility for getting those x-rays more than the patient, because the likelihood of the patient getting it is slim to none. So be aware, which means they're not going to come in. So can I use x-rays that were taken at another facility, that type of thing? Yeah, if you have them, bring them in with you. If not, we can order them when you're here. That's the answer. But the answer is yes. And then the doctor handles it from there. Are they too old? Or are they recumbent or supine? Are they the same anatomy? Sometimes they don't even have the anatomy that the person's complaining about. But I'm not going to get into these types of conversations on a first date. Remember, the first phone call is the first date. We're not going to complicate things. After we get them in, we can kind of work our way through and add different things or help explain different things when they're in the office versus when they're on the phone. Okay, and the common one is, can chiropractic help X? Now, the big question here is whether it's a neuromusculoskeletal condition or if they're talking about a visceral condition. And that's when things get really hairy. Because that's when you start losing credibility, when you start talking about treating paradigm shift non-gateways. That's when you start causing real problems. So, can chiropractic help X? Well, it would be the same answer. So you don't want to just say yes. So the answer is, well, chiropractic has been known to help conditions like that in the past. However, so in other words, we're going to say it's been known to help those problems in the past, and then we're still going to give the generic answer. However, what the doctor would know whether or not he could help is he'd do a consultation and exam, and that would tell him three factors. One, if chiropractic can help. Two, would he need to do more tests? And three, can he start treatment immediately? Does that answer your question? See, that's how it would sound. Can chiropractic help? So next one is chiropractic safe. You're not going to get that one too much because it's a high confrontation. A patient generally is not going to look you in the face and say, is chiropractic safe? So you won't get that a lot. It's out there, but you won't get it a lot. So what is the answer and how to answer, is chiropractic safe? Well, you can't just say yes. You're obviously going to, there's no trust in that. It's you. That's like saying, are you ugly? Well, you're not going to say, yeah, I'm ugly. Okay. So is chiropractic safe? Well, the answer is third party. It's third party. What does that mean? Well, chiropractic safety is based on malpractice insurance. So the less safe the profession is, the higher the malpractice insurance. The more safe the profession is, the lower the malpractice insurance. Chiropractic has the lowest health malpractice insurance of all healthcare providers. So chiropractors pay typically about $1,000 a year. General practitioner medical doctors pay about $5,000 a year. And orthopedists pay about $50,000 a year. So that gives you an idea of who's more safe and less safe. See, so, and that's how that's answered. It's called third party. You can't say yes. You can't say it for yourself. And so that's third party. Is it safe for chiropractic to treat children? And you want to just stick with the generic answer with that too. So, well, that depends. I mean, after a consultation, we would determine whether or not chiropractic can help, number one, and then if there'd be more tests, and then number three is, can you get treatment immediately? But generally speaking, chiropractic can help children, sure. What is the popping sound? Your staff definitely needs to know what the popping sound is. And the short answer is that in each of the joints, whether it's in your spine or your hands, there's liquid lubricant, and that includes nitrogen, liquid nitrogen. And when we adjust the spine, or if you pop your fingers, when you separate those joints apart, that liquid nitrogen goes from a liquid state to a gas state. And that's what causes the popping sound. That's what causes sound. And then if you leave it go for a while, it gets reabsorbed back into a liquid state. That's typically why you can't pop it again immediately. And after you wait a while, you can pop it again. It gets reabsorbed back into a liquid state. But that's a little more complicated. But the simple answer is, what is the popping sound? Well, there's liquid around all the joints, whether it's the spine or your fingers. And when you move those joints, it's the nitrogen in that liquid going from a liquid state to a gas state that creates the popping sound. And it's 100% safe, and there's no side effects for it at all. Matter of fact, it's healthy to move the joints like that. But your staff definitely needs to know how to answer that one. Does the doctor practice X technique? Now, this is rare. In 20, 30, 40 years ago, this was much more common. Do you practice the Palmer method? That every now and then I'd get a question like that. Do you practice the Palmer method? So does the doctor practice some particular technique? Well, if the staff member knows, then answer it. And you should be telling the staff member what, obviously you should be training the staff member on what you're doing therapeutically. What are the different therapies you use? That includes your different techniques. So you should be training your staff on that and then answer it accordingly. But does your doctor practice X technique? So the general answer is, yeah, the doctor is familiar with all the techniques in chiropractic. That's the general answer to that. How many times a week must I get treated, or how many treatments will it take? This is a kind of a common one. You got to be really careful of. And the short answer to that is, well, your body heals in 3 phases, and it's the patient's determination which of the 3 phases they want to get care for. It's that simple. In other words, it's third party. Your body heals in 3 phases, and it's up to the patient which of the 3 phases they want to get treatment for. That's how simple that answer is. How many treatments do I need? That's a common question. You got to be able to answer that one. Can you receive chiropractic care during pregnancy? That's somewhat of a common question. And the answer is yes. There's no side effects from the chiropractic adjustment. Is chiropractic safe? We already talked about that. That's third party with the insurance company. Can I perform my own spinal adjustments? Well, what happens when you move your head or your neck and it pops, the segments that should be moving are the ones that don't. And the ones that are moving excessively. So that's not good. That's the answer to that question. Oh, I can perform my own adjustments, or I can pop my neck myself. Well, here's how that works. Is the joints that are moving excessively, that shouldn't be, that's the ones you're popping, and that's not good. The joints that should be moving that aren't, those are the ones that aren't moving. That's the ones that need to be treated by a chiropractor. Are chiropractic treatments painful? Not if done properly, no. If chiropractic treatments are done properly, they're not painful at all. Matter of fact, they help relieve pain immediately. That's the answer to that. Not if they're done properly. What conditions can benefit chiropractic care? And that's the same question as what chiropractors do. So you can see these questions can be asked in different ways. What conditions? And again, chiropractors treat nerve, muscle, and bone problems, specifically the spine, to help relieve pain and increase mobility. See? Nerve, muscle, bone, spine, and then the symptoms. Help decrease pain and increase mobility. Real straightforward. What symptoms do chiropractors treat? Well, you should know the gateways. Your staff should know the top 10 gateways: back pain, neck pain, car injury, sciatica, arthritis, muscle pain, joint pain, disc bulges or disc herniations, scoliosis. So your staff should be able to round off a good 10 gateways. What symptoms? Okay. How many visits does it take to get better? How many days? Well, how many visits does it take to get better? Well, typically patients feel better on the very first treatment. That's true. By the way, if you're not familiar with it, the statistics are a third of the patients feel better to some degree on the very first adjustment. That's a statistic. So how many visits? How quickly before feel better? Well, typically you'll start to feel better on the very first treatment. That's the answer. What are some common treatments chiropractors use? This isn't going to be asked too much on the phone. They'll ask, well, what are the treatments? Well, what are the treatments your doctor does? So your staff does need to be familiar with your services, such as chiropractic adjustments, physiological therapeutics, muscle stem traction, and most doctors only use 4, 5, or 6 therapies. That's it. So what are some of the common treatments? They don't care about the treatments as much as how it affects them. Can you help me? So you typically won't get that much, but you do know, your staff does need to know how to answer that. Can chiropractors prescribe medication? No, chiropractors do not prescribe drugs. We use all natural therapies. And it sounds better when you say we use all natural therapies. Chiropractors do not prescribe drugs. And I always say drugs, not medication. Medication is a soft word. The reality is they're drugs with side effects. So no, chiropractors do not prescribe drugs with side effects. We use all natural therapies. You see, that's a much better answer. Okay, so that's one that your staff needs to know. All your staff needs to know. Can adjustments make my spine too loose? Can they make it too loose? No. Will they make it loose for you able to move? Yes. Or will they make it too loose? No. Are there chiropractic adjustment side effects? There's no negative side effects. The positive side effects is you'll feel better almost immediately, and you'll start to move better almost immediately. So pain and movement are the two key words when it comes to the effects. Our chiropractic is just other side effects. There's no side effects. The only side effects are you'll feel better, you'll move better, and it's almost immediately on the first treatment. How do chiropractors relieve pain from injuries or accidents? How do chiropractors relieve pain from injuries or accidents? Chiropractic helps relieve pain by helping relieve nerve pressure, and we also use therapies that help relieve pain. So real simple stuff, but you got to be ready for it and you got to be answered. And then this is your generic go-to that will apply to almost all the clinical questions, which is, well, each patient is different. The doctor performs a consultation exam, and that'll determine one of 3 things. One is it a problem chiropractic can help? 2, are there other tests that need to be ordered? Or 3, can the doctor start treatments immediately? Does that answer your question, Mary? Okay, we can schedule you for today or tomorrow. What works best for you? That's what it would sound like. Those are the most common questions. Those are the most common clinical questions. So do get familiar. And the best way to learn all of these, how to answer the phone, because remember, every staff member has to know these. Every staff member. And they have to know them fast. It's got to be in muscle memory. And what's the best way to do that? Well, it's role playing, number 1, and it's role playing with flashcards. You just pull up the flashcard with the question, you read it, just like if you were a patient on the phone, and listen to how your staff answers it. And then you correct it accordingly. And so answering the phone is very important. There needs to be a lot of time with training on how to answer the phone. And most doctors spend little to no time on how to answer a phone, and they'll lose a lot of patients and not even be aware of it.